tips to help weather the coronavirus crisis. We're living through a challenging and unprecedented time. And to help us navigate through it, I'm delighted to introduce Dr. Jill Barron. Jill, I think you need to add your video. There she is. Dr. Barron is a board-certified family physician who practices cutting-edge integrative and functional medicine in New York City. She's a graduate of Princeton University, the Icahn School of Medicine at Mount Sinai, and residency trained at SUNY Stony Brook. Dr. Barron is certified by the Institute for Functional Medicine, the American Board of Integrative Holistic Medicine, and the North American Menopause Society. She's also a visiting attending physician at the Mount Sinai Hospital in New York City and a clinical assistant professor of family medicine at the State University of New York at Stony Brook. She's the author of the forthcoming book, Don't Mess with Stress, and you'll get a lot of the tips from that book as we continue tonight.
Thank you, Wendy. So my interviewer, Wendy Gerber, is a global brand strategist and also a close friend and former Princeton roommate. Wendy is CEO of the International Consulting Group and has worked with Fortune 500 corporations, including Citigroup and Ralph Lauren, as well as startups. Wendy develops innovative strategies in marketing to drive business growth and impact. She also builds brand purpose, helping companies lead with purpose, which is particularly important during this challenging time. Wendy graduated from Princeton's Woodrow Wilson School, NYU Law, and also attended the Wharton School.
Thank you, Jill. So I'm living in New York City, as I'm sure a number of you are. And with today's news that 21% of New York City residents tested positive for coronavirus antibodies, a far higher figure than medical experts had thought, I'm particularly glad that we have Jill here tonight to hear her insights so that all of you feel empowered and a bit calmer at the end of this talk. Jill's going to be speaking and then we'll do question and answers at the end of her talk. Jill, thank you so much for joining us tonight.
Thank you so much, Wendy, and thank you to the Princeton Club for having me here. So we're all living through, as you know, a very difficult time with this pandemic, when we're sheltering at home and can't be near loved ones and feeling isolated. And before we get started with our interview, I wanted to acknowledge the first responders and frontline physicians, nurses, healthcare workers, delivery workers, food, restaurant people, whoever is there to help us survive and thrive. And I wanted to also honor the memory of all those people who have passed from COVID with a moment of silence. Thank you. And we have a slide up there to show our first line and frontline workers.
And I have to say, one of the most rewarding and inspiring parts about being in New York City at this time is at 7 o'clock at night when everyone leans out their windows and cheers and pays tribute to the healthcare workers on the front line. So for all of those of you in New York who are on this webinar, please at 7 o'clock, open your windows, give thanks for all that everyone is doing to save our lives. Thank you. So Jill, we're living through this incredibly difficult time with this pandemic, sheltering at home, trying to flatten the curve, being away from our loved ones, feeling isolated, dealing with financial stress as well as health worries. Do you have any thoughts about when things might get back to normal?
No, Wendy, that's a great question. I mean, what's happening now is really unprecedented, and we're kind of doing things as they come and learning. We've had a tremendous learning curve with the coronavirus. Thank God, admissions are decreasing in the hospitals, deaths are decreasing, but we really don't know if we're out of that window, if it's really safe to stop wearing masks and stop sheltering and stop quarantining and stop social distancing. So I really don't know. I think that New York is part of, and other states nearby are trying to do tracing and tracking to see who's infected. But again, there are many people who either have the coronavirus and have been tested but don't test positive, but they do have the symptoms. And that could be for a number of reasons. Either the sample is not good. Again, the swab has to go in and deep into the nose. Maybe the swab specimen is not a good specimen. And also there are people, who haven't been tested who also have symptoms. So it's really hard to know really how many people are infected. Then we also have people who are carriers. So it's really hard to know, what's going on in terms of that. Also, in terms of the antibody tests, this is really unknown territory. I give the example of a researcher. I recently heard a researcher speak who said that he wanted to see and test these antibody kits. So he got 4 different antibody tests kits, and he ran them. They were from 4 different companies, and he got a different result with each one. And as Dr. Fauci said, I think on the 20th, in an interview with Good Morning America, we really don't have valid antibody testing. There are people who also can be positive, and there are people maybe who may be positive and not show positive.
So the news today about the 21% of people testing positive for antibodies, that isn't necessarily a dispositive number, right?
Right, that's right.
Okay, so lots of uncertainty that we're all wrestling with today, and it's really a challenge. So our goal tonight is to learn how to build resilience, boost our immunity, and find ways to stay calm during this crisis. No easy task this right now. We'll get into the details on this in a few minutes, but first I'm sure everybody would like to know, Jill, what have you been doing to cope through all of this, and how have you personally handled the crisis, and what's been most effective for you?
Yes, well, I want to say that I'm very fortunate that I did leave the city. I was fortunate to have family outside of the city where I'm staying. I'm staying in a nice place with nature around, so that's very calming. And I'm doing my telemedicine with my patients from here. So I'm still in contact with my patients. But to help myself, I have a few practices that I do. One is I keep a yoga mat next to my bed, and I brought mine with me. I keep it unfurled because I know that I might be a little bit lazy if it's rolled up and not open it up. So I keep the yoga mat open next to my bed. And every morning, pretty regularly, almost every day, with rare exception, I do some yoga stretches, not a whole, hour routine, but just to stretch, because it's very important to have flexibility. And I believe that when you have flexibility in your body, I believe it carries over to your mind and makes you more flexible. So I do that. I practice a type of meditation called transcendental meditation, which I've been doing for a long time. And I try and do it twice a day. And I really do find that when I miss it, I don't feel as good. I feel that when I do the meditation, and it's not just one way, and I'll be talking about that in a little bit, but that when you have some kind of meditative practice, it definitely helps to calm the system, which is what we want to do. And I think that, if part of what I'm going to talk about is to kind of keep calm and keep what's called the parasympathetic nervous system going. So we have 2 types of nervous systems. We have a few different types of nervous systems, but we have what's called the autonomic nervous system. We have what's called the fight or flight, or the sympathetic nervous system, and then we have the parasympathetic nervous system, which is the calm and peaceful type. And I think now it's really important, and it's not easy, again, as you said, Wendy, living in these uncertain times, which is very anxiety producing for everybody, including myself. But we need to learn ways to tamp that down. And by using techniques, by meditating, by doing yoga, by doing breathing, it's very important. And also by how you think, it's very important to kind of keep that in check when possible. So in addition to that, meditating and doing yoga, I try and eat right. I'm not perfect, a little bit of chocolate here or there, or dessert, but much less, and get fresh air. So there are things that you can do that are very important.
Okay, we all have to have our comfort foods. So in addition to managing and trying to stay calm, I think one of the things that's concerning a number of us is trying to build up our immunity. I know I have my bottles of vitamin C that I try to regularly take every day. What can we do to shore up our immunity and our resilience? You have a program that you discuss in your upcoming book, Don't Mess with Stress. Can you fill us in?
Yes, so this book has been in the writing for a while, but hopefully it will get done fairly soon and we'll really celebrate. But the way I was thinking about how people can increase resilience and increase and kind of optimize their immune system is by having a foundation. Think about soil. If you have bad soil, you don't grow good food. But if you have good soil and a good foundation, it's a great place to work from. And so my foundation, what I call the Don't Mess with Stress Foundation or program, is really like kind of an acronym. D is for don't, diet is D. M is meditate. W is walk, move, exercise, dance. And S is sleep. Now, it can be stressful if you're thinking to yourself, well, I'm not doing any of that right now. You know, again, it's baby steps. You have to do baby steps for any kind of program. But if you think about it, if you have a healthy diet, if you have some sort of meditative practice, yogic practice, you move, walk, and I'm going to go into a little bit of why these things can help possibly protect us possibly from COVID, and then get adequate rest, you'll see that that's really important for your immunity.
And I think part of what you're saying about taking baby steps is we really have to accept ourselves as we are now. We may not be able to do everything optimally. We may not be able to take all the tips that you're going to share with us today and incorporate them into our daily lives. But really, we have to stay strong, believe in ourselves, know that we're going to get through this and come out the other side and hopefully emerge stronger and better as a society, as a community, as a neighborhood, as a result of having gone through that.
Definitely.
So for me, living in New York City, as I'm sure many on the call are experiencing, we're struggling, even with getting dates to deliver supermarket goods. So we're trying to balance eating healthy while also enjoying some comfort foods. Can you give us some tips on how diet can help us?
Yes. So diet is very important, obviously. And what you eat, what you put into your body, of course, can affect everything in your body, your mood, how your energy level, how you feel, your immune system. So there's just a few tips I want to give you. And most of you probably know all this, but it's just good to hear it and maybe you'll learn something. So it's important to limit sweets. And you really want to have an anti-inflammatory diet, like a Mediterranean type diet, but limiting sweets. And why is that important? Because sweets, sugar, binds to proteins. And when when sugar binds to protein, you get what's called AGES protein. Believe it or not, AGES. It stands for Advanced Glycation End Products. It's kind of interesting how that's that word. And so what happens is when the sugar binds to proteins in your body, it binds to proteins in your brain and all over your body and can cause inflammation. And right now, you want to be able to preserve energy. In Chinese medicine, they use a term called qi, which is life force or energy. We're born with a certain amount of qi, and then as we go through life, we kind of burn it up. But there are ways to increase qi. And what you need right now, especially, is you want to build qi. You want to build your life force so you can withstand, God forbid you were to get COVID, you would hopefully do better. So along those lines, I would also limit alcohol. Alcohol, I'm not saying to stop. If you ideally, it'd be probably better to stop, but don't stress. But just limit it, because everything that you take in, including alcohol, is metabolized in the liver. And if your liver is kind of sluggish, then it's not really good for your immune system. I also think it's important to drink hot fluids. Again, in traditional Chinese medicine, also in Indian medicine called Ayurveda, even in Western medicine, the inside of your body is 98.6. So when you drink ice cold water, it's really a shock to your system. And you're using qi. And according to one of I'll call him master and my teacher, Dr. Nan Lu, he says that it's important to eat cooked foods, ideally during this time, especially drink hot fluids. So I recommend, and so does he, drinking boiled hot water, not to the scalding point, but you boil it. It can also be room temperature, but not ice cold. And what's important also is to put fresh ginger. He recommends that number one. If you can put a few slices of fresh ginger into your water after it's boiled, because it's anti-inflammatory, it's an antioxidant, it's warming, it's anti-nausea. Then what you can also do is add some honey. Honey, according to Chinese medicine, moisturizes the lungs. And especially right now with COVID, you really want to protect your lungs. And I think there's a question that you're going to be asking me about protecting your lungs. So that's really important. And then lastly, the Mediterranean diet, which is really an anti-inflammatory diet. Fruits, whole foods, fruits, vegetables, nuts, fish, olive oil, some grains, some whole grains. This is really an anti-inflammatory diet.
So with the difficulties getting food, if you're not able to go to supermarkets, a number of people have stocked up on canned vegetables, frozen vegetables. How much in terms of nutrients are we losing as a result, or is it still good to eat as much of that as you can?
That's a great question. I also want to say that if people can't get ginger, if you have some cinnamon, by the way, cinnamon at home, cinnamon is a warming herb, and that's also very good for digestion. And believe it or not, if you don't want to use honey, I mean, either one, you could put a little bit of, I never thought I'd say this, but according to Nan Lu, who I trust, a little bit of brown sugar. Just a little bit, because brown sugar is also warming for the digestive system. And just a little bit of, brown sugar, half teaspoon, a quarter teaspoon in that ginger and hot water might be helpful. So I wouldn't stress, if you can't get food, just do the best you can. Food is only one part of it. If you have bad thoughts while you're eating, that's worse. If you're not eating the greatest food, that's worse for you than eating good food and being aggravated and stressed.
Okay, that's a good point. We have to accept ourselves. Are there any specific supplements that you recommend to help strengthen our immune system and increase resilience?
Yes. Well, there are several. I'm just going to cover a couple here that I think are important, and there is data behind them. So first, I'd recommend vitamin D3. And again, I want to say this out front. If I'm not your physician in this talk here, it's important that you consult your physician or health provider before taking my recommendations about supplements and that kind of thing. But generally, vitamin D3, 2,000 international units once per day with food that has some good fat is very important. That vitamin, now the reason why I say good fat is that vitamin D is a fat soluble vitamin, meaning that to get the best absorption, you want to take it with some good fat. So maybe some avocado. I mean, most of our food probably has maybe some good oil in it, some olive oil with some food. So that can absorb, because a lot of people who have low levels and if they're taking vitamin D3 may not be taking it with food that has some good fat. And vitamin D has been shown to have antiviral and good immune effects. So I'd recommend vitamin D3. According to the Institute for Functional Medicine, of which I'm a member and a practitioner, they recommend that if you get COVID, you should go up to 5,000 international units per day of D3, irrespective of knowing your levels. And a blood level, under 20 is considered deficient. The second supplement I'd recommend is vitamin C. So there's also good evidence that vitamin C, is antiviral and also good for the immune system. And I'd recommend taking 500 milligrams to 1,000 milligrams. And the type I'd recommend would be ester C, ESTERC, because ester C is less acidic. And you should not take vitamin C, by the way, if you have any history of kidney stones, because there are some kidney stones that can be caused by vitamin C. But if you're eating it in your food, that's also okay. So vitamin C is important. And I would take that with just food. You don't have to worry about fat, but just food. So it's better on your stomach. The last supplement, which I think is helpful, and again, I'm making blanket suggestions. I don't know your medical history, so be careful with this. But I'm going to recommend zinc, and also the Institute for Functional Medicine does recommend some zinc. I know zinc's been hard to get, but zinc has antiviral properties. And I recommend if you're going to take zinc, the dose would be between 30 milligrams and 60 milligrams a day, but for no more than 6 months if you're going to take zinc alone, because usually zinc is balanced with copper in I think it's a 15:2 ratio, 15 milligrams of zinc to 2 milligrams of copper. Hope I didn't get that backwards. Anyway, but you should take that 30 to 60 milligrams, 30 to 60 milligrams of zinc in divided doses. Zinc comes in zinc acetate, zinc citrate, zinc picolinate, or glycinate. There are also zinc lozenges which you can take. So zinc has been very, very helpful. These three supplements, I would say, are good starters.
And what about just taking a multivitamin? Does that make sense right now? And
Yeah, I mean, you know, I probably wouldn't hurt you. Again, people now with multivitamins, women who are in menopause should not take a multivitamin that has iron in it, because women in menopause are not getting their periods anymore. Just like men should never take a multivitamin unless they were instructed by their physician, a multivitamin with iron, because they don't have any way of excreting iron, just like women who are menopausal. So if you're going to take a multivitamin, take one that if you're menopausal, meaning you don't get a period anymore, or if you're a male, take it without iron.
although there are some people who are anemic that need the iron as well.
Right, but again, yes, but if they're anemic, they may be taking additional iron to treat that iron. If it's iron deficiency anemia, there are different types of anemia.
So while there are many, many uncertainties, both in the medical community as well as the public at large about COVID, we do know that it primarily attacks our lungs. Are there things we can be doing proactively to protect our lungs?
Yes, so, and I've already indirectly talked about some of them. So there are things that you can do to protect your lungs. So I just talked about honey, which is moisturizing for lungs. Hot fluid is also another reason that hydration is important for the lungs, is that it also thins out the mucus and it makes you ventilate better. So hydration is really key. And I believe hot clear fluids or room temperature. And along those lines, chicken soup, believe it or not, the Jewish physician, the 12th century Jewish physician Maimonides, recommended chicken soup way back when to quote unquote neutralize the constitution. And research has shown that chicken soup, I'm just reading here, mobilizes nasal mucus better than other hot liquids. So, and I don't think it's been sussed out what in the chicken soup is the miracle, for making people feel better. But there is evidence. There's a journal in the study in the journal Chest, which is a lung journal in 2000, that said that chicken soup had a mild anti-inflammatory effect, which is why it might be good against the common cold. Now, if people are vegan or vegetarian and they don't eat meat, they can make a hot water, they can have a vegetarian broth, they can put in garlic and onions and ginger, which all have antiviral properties. I would also throw this in your grandma's chicken soup. But so I believe that chicken soup is good in terms of hydration as well. Again, watch the sodium. A lot of the canned chicken soups are so high in sodium. And I really mean to write to these companies, because you can really get high blood pressure by eating all these high sodium foods and these high sodium soups. So in addition to hydration, it's also aerobic exercise is also really important for a few reasons. Ideally, it's best to exercise. It would be great to exercise in fresh air, again, 6 feet away from people, of course, or well ventilated indoor spaces, because aerobic exercise both strengthens cardiovascular health and it improves lung ventilation, which could also lead to better COVID outcomes if people become infected. Lastly, I want to talk about, two more things, that good ventilation in your house or apartment and frequent cleaning of the environment of individuals that are ill with COVID. So if you live with someone who has COVID, it's very important to frequently, clean the sheets and clean the environment if you can. Open the windows and air. I'm not a big believer. I don't love these kind of air fresheners that I don't want to mention any names, but I feel like they're toxic. I don't want to mention names for these air fresheners over the counter, but I wouldn't use those, but good ventilation and maybe some natural things. And lastly, what could also help you with your lung ventilation is to do what's called simple diaphragmatic breathing. And I bet that a lot of people here may practice this, but this is also calming for you. So if you're feeling stressed, you can do it. I'd like to take you through just a brief, a simple diaphragmatic breathing exercise. So if you're sitting down, which I assume that you are, what you can do is you can take one of your hands, either your right hand or your left hand, and just also put it on your abdomen, right below your belly button or around your belly button. And then, just ideally put your feet on the floor and your back supported if you can. And then keeping your hand on your abdomen gently, take a deep breath in through your nose. And ideally feel your hand being pushed out by your abdomen. Focus on the hand, and then gently and slowly exhale through your mouth and feel your hand on your abdomen go back in. Let's do that again. So what you're going to do is you're going to keep your hand on your abdomen. You're going to focus your attention on kind of taking a deep breath and pushing your belly out gently and feeling your hand go out. And then when you do a long and slow exhale through your mouth, you'll feel your hand and your belly go back in. So here we go. Take a deep breath in through your nose. Feel your hand push out your belly, and then gently and slowly exhale through your mouth and feel your abdomen go back in.
Jill, I've heard that it's actually beneficial when you're breathing out that lasts longer than the inhalation. Is there any truth to that?
Yeah, yes, there is truth for that. So if you're just beginning and you can't do it, that's okay. But the slower and longer through your mouth is probably more helpful. But again, don't stress. If you're just starting out, just practice and just think about kind of breathing into your belly. And then with practice, you'll get better. And you could do this before you go to bed, or if you wake up and you have insomnia, you could also do this deep breathing. If you want to, when you're in bed also, you can take your opposite hand, like your left hand and put it on your chest, and you take the breathe in, and you can feel can feel the upper chest being quiet if you can. It's another way of kind of keeping your upper chest quiet when you breathe, and then exhale.
It's interesting, that type of breathing through the diaphragm is actually what actors and singers learn how to do. Yes. Okay, terrific. Well, we know that you have been very involved in traditional Chinese medicine as well. Can you give us a recommendation from this type of healing that can help us increase our resilience and immunity?
Yes. And right, what I'm going to do, everybody, is I'm going to stand up. So this is a technique that can be done anywhere. And according to Dr. Liu, it's a very powerful technique. It can help your lungs. It can help your colon if you have constipation, if you feel a little nauseous. It can help your brain. It also might help headaches. And he told me it might help longevity. So I can't guarantee this, but I do it. And what I want you to do is take, let's say, your left hand. It may look like my right. So whatever's easier for you. And what you're going to do is you're going to take the opposite hand with your thumb. And in this hand here, there's a little, right between the thumb and the forefinger, there's like a little fleshy part. And right above it, you're going to take the opposite thumb and massage it in a circle. It actually might hurt. So you can put your hand out, put the other one over it, and then put your thumb right between the other thumb and index finger and massage this point. And if it hurts, as Dr. Liu said, you have some stagnation. Mine hurts, so there's probably always some stagnation in us. But if you can do this for 2 minutes on one side And then 2 minutes on the other side. That's going to be really, really good for opening up meridians, which are energy channels in the body. I feel a little bit right now, and that's very powerful. And he said during this time, actually, it's really important to do that. There's also one more technique, Wendy, that I'm going to show everybody, and that he said this is also really important. And by the way, you can do this every day, 2 minutes or more, 2 minutes each hand. You can do it while you're watching TV, whatever, listening to music. You can do it. You can do it more than that. The second one he taught us, and I'm hoping it's okay that I'm telling you, is between your nose and your upper lip, take your thumb and right just, with the kind of the side of your thumb or the fleshy part, go in a clockwise, so you're looking at me, so it looks the opposite way, in a clockwise way, circle, like this. He said that this point, this acupressure point, is really powerful for this, in this time, for trying to prevent COVID. So if you can do, this point is called lung, I think it's called lung 4 or colon 4, I'm not sure. And then this one over here, he said, do this 3 minutes a day, twice a day. That will help you. There's some other points, but I don't think we have time to go over it right now, but I would check those 2 out and do them every day. Might be helpful.
Okay, great. Thank you, Jill. I know that stress builds up for all of us between health concerns and financial issues. I've been inside my apartment for 4 weeks now, and all I have to say is I'm very thankful for Netflix and other streaming services. What are some other stress relievers that you recommend, Jill?
So I love to laugh, and there's been a lot of evidence about laughter. I know that laughter may seem like an anomalous thing during this time of complete uncertainty and all that's going on. But here's a little slide for you Princetonians I thought that you might enjoy. Clorox before and after. So it's a very cute slide. And I sometimes will watch YouTube videos, Saturday Night Live, whatever, but just things to make me laugh. Laughter can be either induced or spontaneous. And I want to actually give you some research about laughter. There's been evidence from published in research journals, the therapeutic benefits of laughter. There are both physiological outcomes. For example, it exercises and relaxes muscles and improves respiration. When you laugh, if you laugh hard, you're breathing pretty hard. It stimulates circulation. It decreases levels of stress hormones, increases the immune system. It also enhances mental functioning. In addition, there is some psychological outcomes from laughter. It does reduce stress and anxiety and tension, and may even help depression. It may enhance memory and creative thinking. It improves interpersonal interaction and psychological well-being. And happiness and mirth is contagious. So you can laugh with people, but laughter can also interrupt and change your state if you're feeling not good. That's really important. Find ways to laugh.
That's great, Jill. And I've also heard that gratitude is really important. And just as we're grateful for healthcare workers protecting our lives, it's important to thank those people who are in your lives, whether family, friends, however you're getting together with them now, whether virtually or in person with social distancing, to express gratitude for the role they play and the support they provide you in your life.
Totally. And Wendy, you asked me what I'm doing. And in my notebook, every morning I write on the top of the page 3 things. I write down inspire, underline, I put gratitude, 3 headings, and I put accomplish. And every morning I either write my own inspiration, that's respiration, inspiring quote, and then I will then write down 3 or 4 things that I'm grateful for. And when you actually do this, there's research that shows when you actually can embody the gratitude and say, for example, I'm so grateful for my friend Wendy, who's here interviewing me, and she's done these great slides, whatever, and these great questions. I can feel that. I can feel that in my body, or I'm happy that I can hear, or, you know, I'm happy that I can breathe clean air. But by writing these things down and actually taking like a minute to write these down and really embodying them, I can feel it in my physiology. You can actually also improve the immune system. And, you know, people say, well, you know, what if you have the same great gratitude things every day? So what? But I've also read that by thinking of other ways, even let's say you're happy you made your bed today, you know, these little things, it's okay also to repeat things, but find small things. And at the end of my day, I will accomplish. I may put down, I'm happy I made my bed today. And by the way, I believe that making your bed is really important for some stability. This has been done, I think, in the military. There's actually a book out there called Make Your Bed. But that by making your bed, that's one task that you can check off. It also provides you, if you're working in your bedroom, you know, with some calm. So these are things that I find helpful.
As long as you don't have to make hospital corners.
Right, I do make hospital corner, right? I don't bounce any coins though.
One of the interesting things I think for all of us, individuals, corporations, is how we're learning to pivot in this new time. And I know that for me, I started a Zoom happy hour with friends, including Jill, once a week, which has really been great. It's given us a chance to reconnect virtually. And ironically, it's something that we probably wouldn't have done without this pandemic. Jill, what are your thoughts about other things people can do? And I'll add, we have about 5 minutes more of speaking, and then we'll be going to questions.
Yeah.
So you can start typing questions in if you have specific questions for Jill.
Right. So, you know, lack of physical contact is a big one, and not having anybody to touch you, or to see friends or be out in the streets is a big problem. So things like what Wendy has done, these Zoom groups, or, you know, with families, has also been a silver lining. And just so kind of being with people in that way is also helpful. Trying maybe to engage with people in different online and different, maybe a book club or those kinds of things is also very helpful. Wendy, one thing I didn't mention I wanted to touch on was sleep, if you will, and the Don't Mess with Stress foundational program. And, you know, sleep is a very challenging thing, and it's very important to get adequate sleep, and it's insomnia is a big problem before this COVID, but also, you know, in the COVID pandemic. I've gotten questions about, you know, from patients who haven't been sleeping. At times I haven't been sleeping. So what can you do? And this is one of the things that I'm still working on is sleep. And what you can do ideally is that what the sleep experts say is that you want to have a regular time that you get up and a regular time that you go to bed. And not easy. I know that I look at my phone probably before I go to bed. I'm still trying to wean myself off it, but the blue light from these screens can really affect, I believe, the pineal gland and melatonin, and can keep you up. So what's recommended is minimally to stop using screens about 1 hour before you go to bed. If you can take a hot bath with some Epsom salts, that would be great. Or do something that's calming, listen to calming music. Keep your bedroom on the cool side. That's also been shown to be helpful. Now, there are many types of insomnia. There's the beginning where you can't fall asleep, the kind that when you wake up. Of course, I can't go into every detail right now, but in terms of if you wake up, you can try and do that diaphragmatic breathing. You can also try and shift if you wake up panicking or ruminating about fearful things. It's not easy. You can start doing that breathing very, very slowly. And then also try and shift your attention to something positive. Even think of a loved one, or think of something totally different. Just shift your attention in that moment to something that you're grateful for even. I mean, that you have a bed to sleep on, let's say. I mean, there are people who don't have food, but these little things might help you to shift your brain, interrupt that cycle, and kind of calm it down. There's also a supplement, which I'm sure most people know about, called melatonin, which actually is one of the most powerful antioxidants on the planet. Now, again, if you have a physician, you should speak to your doctor about this, but melatonin can also be helpful. And a lot of people say it doesn't help. It also may be protective of breast cancer, believe it or not. But and I believe it also has some immune function benefits. They're actually recommending it for COVID. So what kind of dose to take? If you can't sleep, I would take it before bed, maybe a half hour before you go to bed. You start out with 2 milligrams or 3 milligrams. And, it depends if you're sensitive to these things. You have to get a good brand. Again, many of these supplements may not have the mineral or the supplement actually in it. There are people that, supplements that don't know, they're not the best quality. And so you can see how you feel. And then you can go up. They said if people get COVID, they should take, I think, between 5 and 10 milligrams. I wouldn't quote me. I don't have that in front of me, but be very careful because melatonin can cause sedation. And so again, I would do this under the physician's care, but that might be helpful.
I've also seen there are a number of apps that people find helpful, like
Right.
there's one called Calm, which has really calming aspects to it. There's another one called My Noise, which provides kind of a white noise to people having trouble sleeping. The flip side is, I guess you have to use your cell phone to do that, which we're told to stay away from for an hour before we go to sleep. But there are some new technologies that can also help us. One of the silver linings that I've noticed in my work, focusing on helping companies drive business growth with a triple bottom line approach, looking at people and planet as well as profits, is that the lockdowns around the world have really helped to clean the air in a number of countries, including China and Italy. And David, if you'll pull up a slide, this shows you the dramatic difference between the India Gate in New Delhi. Between 2019 and this week, you can see how the air quality has improved. And actually, pollution and air quality can also play a role here with COVID, right, Jill?
That's right. And especially, I feel bad. We're New Yorkers and we live in an environment where there are fine particulates in the air. And we know that inhaling fine particulate matter, which is very small, can cause cardiovascular disease, which could then be a predisposing risk factor for COVID. So it's a tough challenge because we do live in an industrial environment.
But I assume in striking the appropriate balance, it's still better to get fresh air from your window.
It is, yes,
right?
And again, it is, and I wouldn't stress about it. Those of us who have been living in New York, I mean, the air quality has improved. We have electric buses and people are working on that. But yes, particulates can be, affected. And thank you for showing that slide. On top of that, though, I want to tell you, there was a woman, I believe, in England, whose job it is to measure the vibrations in the atmosphere. And so apparently, with all the different kind of basal noise that's going on with cars and noise, there's a lot of kind of rumbling in the environment. And she said that she has a meter in her apartment, and she's like kind of a full-fledged, this is what she does, and that the hum, the basal hum that's usually in the environment has really, really dropped because people are not using cars as much. They're not using, cars, trucks, you name it, machinery. Industry is down. There are fewer airplanes, so that whole environmental hum has decreased, which is really, I think, quite beautiful in a way.
It's fascinating, and there are satellite photos showing the air above China and Italy that really shows very dramatically how our lockdown and the lack of industrial activity has really has shown, number one, the important role people can play in curbing greenhouse gas emissions, and also just how tremendous the impact of the lockdown has been. Obviously, way too high a price, but a lot of the things we're doing in our lives now, if we can adapt to have more of a green infrastructure, everybody will benefit. And even I saw one photo of Venice that for the first time ever, the water is so much more clear that you can actually see fish swimming in the canals. So
Amazing.
Jill, the last thing that I'd like to ask you is, we're really inundated with news now. We're inundated with studies, with information, many of which is very inconsistent. So what sites or people do you recommend that we look to get accurate news?
Wow. That's a great question, Wendy. um, you know, I get information. I'm on the staff of Mount Sinai, so I get information daily about what's going on in the hospital there. You know, I guess the CDC, there are all kinds of theories, there are conspiracy theories. It's so hard to know what the truth is these days about what's going on. But I guess the CDC was saying that it may be worse in the winter. I want people to walk away though with feeling uplifted after this, but there may be another outbreak in the winter and it may be worse. So that's why these tips and tools are really important to kind of do our best to stay healthy and resilient. So I don't know what the best source of news is. I guess the CDC. I'm also part of the New
WHO,
York Times.
I assume.
What?
WHO, the World Health Organization.
World Health Organization, although yes. So yeah, bodies like these are hopefully giving us the right information.
And I will add, just so people don't get too alarmed, when the head of the CDC talked about that things might be worse in the fall, he very quickly clarified that that was because we were going to be dealing potentially with both the coronavirus and the flu, and that it was going to be difficult to identify what was what at that time period. So now we're going to move into questions. Thank you for those of you who have submitted them. Please, everybody, feel free, look at your Q&A button and feel free to share any questions you might have. So Jill, first question comes from Gina. How do you convey to friends and others in a polite way that negativity is draining and can actually diminish the immune system and add to stress?
Great question. Great question. Well, you can say to them, maybe you can ask them, how do they feel when they're saying these negative things? How do they feel if they droop their mouth versus smiling? You know, what do they feel in their bodies? And you can see, I know if I'm thinking negative, I feel it in my body. When I'm thinking positive, my endorphins are probably flowing and I feel much better. But these things, the negative thinking really affects the immune system, really affects the immune system. I was talking to a patient yesterday who called me for a phone consultation and said to me, I'm calling you because I'm afraid I'm going to die from COVID. And I had to basically talk him down and also acknowledge all the good things he was doing for himself. This is a guy, by the way, who I want to say, he gave me permission to say this, and it may be helpful for you as one of the possible silver linings, that had very high blood pressure, was very overweight, high cholesterol, heart disease. He's lost like 25 pounds. He's spending time with his kids. He's exercising. He stopped drinking, barely drinking. He said he did what's called a quote unquote hard reset on his life. And when I showed him and I told him that all this stress and worry is not going to do him any good, I said, look, anybody could get it, but you have to kind of just do the best you're doing and just let go. That's all you can do. That's all you can do.
That's great. And I think also showing positivity is good too. The more upbeat you can be, the more understanding, the more empathic you can be of other people's situation. That positivity feeds on itself with other people and can help inspire them as well.
And one more thing that you can tell your friends is that when you're with them, it's making you feel bad and making you feel ill, you know, not good. So
somebody else asked about recording the Zoom and whether it would be available for family members who couldn't watch it now. And yes, Jill and I and the Princeton Club will be speaking about this, but we do anticipate it being available and that the Princeton Club will be sending it out. Let's see. So Lynn has asked, what are the most effective ways of keeping oneself active? And how can you structure a day when you can't get anywhere and keep up a meaningful daily routine and schedule when you don't have any mandatory schedule?
that's a great question. That's a great question. First, if you're home and you are not working and you don't have anything going on, maybe what you can do is first allow yourself to do nothing. I mean, maybe for a day or two, stay in bed, be in your pajamas, watch TV, binge watch if you like, you know, kind of let yourself do things that you would not ordinarily do. And what I do though is every day, I make a schedule for myself. I purposely make myself a schedule, and I put in things. I have stuff to do. I'm also running a practice, and I'm also just putting in things that I feel I need to do. And and I find that when I write them down, I have like two lists. I have a calendar on one side and my to-do list on the other. And it's funny, this may be helpful for you. I got this book, I don't get any money for it here, but the bullet journal method, which is really an interesting thing about how to do what's meaningful in life and also kind of organize your calendar. You know, for years I've been doing different things. And so I have this calendar that I've made. You know, I have on one side, I have my you know, here I have the day, the times, and here I have my to-dos and notes, and I have my inspire, my gratitude, and my accomplish. I haven't put my accomplish in yet, but it helps me to see that in front of me. And I'll say from X time to X time, I'm going to do this. And I try and do it. If I don't, I move it on to the next, you know, time I can do it.
That's great.
I hope that's helpful.
I do.
And
that.
also, may I say, by having some kind of meditative practice, morning and night, they're like two anchors. So that also helps you structure your day. I would say get up, you know, do your meditation or yoga meditation. You can learn mindfulness, get from apps, whatever, and then make your bed. That also helps.
Okay, and it's interesting. I also use my cell phone to keep my calendar. So
well, I do too, right? There are many ways to do it, many ways.
So, yep, just do whatever works for you is the bottom line, because you have to give yourself the latitude to both be diligent in terms of maintaining a schedule and also give yourself the ability to take advantage of this time when we're all working remotely and sheltering at home, and be able to have the freedom in terms of your scheduling to do some things you might not have been able to do in the past, whether it's reading. I know for me, I did a Zoom session with my daughter and we drew together. And it's something that I used to love to do and haven't done in a while. So having those opportunities to kind of reinvent yourself or capture parts of yourself that you had not had the time to take advantage of before, those are some of the positive things that we can look back on when this is all over.
I know I have my violin in the back, but I've only taken it out once.
Yeah, a lot of the discipline things that we're dealing with are really things that we confront in our daily lives generally, and they're just kind of exacerbated right now.
I struggle with it too, don't worry, the whole schedule thing, but anyway.
Yeah. So someone also wrote in saying that they loved your suggestions on vitamins, but they hadn't taken notes, and where could they find the list? So I'm going to answer this one and just say that at the end of the talk, you'll have a contact sheet with information on how to reach Jill, how to reach me if you have any questions or want additional information.
Yeah, I do. And I want to say, Wendy, right, I have a newsletter where I do make suggestions, and you could, if you're interested, you could sign up on my website.
That's great. And while we're talking about that, Jill, when is your book coming out? Don't Mess with Stress.
Talking about Don't Mess with Stress, I have to have full disclosure. This has been a very stressful thing. I spoke a year ago, April 29th, about my book being published in June, but I'm really going to try and get it done in the next few months. I know, believe it or not, I'm going to have to get it done. I have the time now. I have my roommate here. I have people who know about this for a long time. I'm embarrassed, but I'm human, and I have to get past that and just do it. You know, I have perfectionism issues. I want to do it right.
That should give everybody the latitude to know that you may not accomplish everything you set out to, but that's A-okay. So somebody else asked, and this is a big question right now, an important question, when we're buying fruits and vegetables, what's the best way to freeze them? Should we rinse them in a solution before storing them? Should we cut, remove stems? Should we blanch them first?
Yeah, so what I would do, and there was I had a video, there was a video that was put out by a family physician about how to clean your food and in boxes and stuff like that. What they're saying now is that when you're buying fresh fruits and vegetables, well, what I'm doing is if we get, I wear gloves, and if the vegetables and fruits come in a bag, I have an area where it's quote unquote dirty, and we'll either have a clean bag, someone may hold a clean bag, and we empty those fruits and vegetables into a different bag that's clean. And then when we use them, we'll then clean them, with vegetable wash and that kind of thing. We were initially cleaning all our vegetables and fruits with some soap and water. But just so you know that fruits and vegetables are porous and they take in things. So be careful about what you use. I would just rinse them with vegetable wash, and that's what I would do. In terms of freezing them, I don't know much about freezing fresh fruits and vegetables, but I would probably not rinse, you asked about rinsing in a solution before storing. I probably rinse them as you use them.
Okay, and there's some interesting tips actually that I've learned from my daughter, and I do a lot of cooking, and there are a lot of things that you didn't realize you could freeze that you can. You can freeze parsley, you can freeze avocados. There are so many things that can be frozen. I'm very happy to learn about the soap information, Jill, because I have been washing my broccoli and my green beans with soap and water, but hopefully that's okay. Are there any other questions that anybody would like to ask? Okay, well, that brings us to the end of our questions. David, if you can post contact information now. Thank you, Jill, and thank everyone who joined us tonight. If you'd like more information, this is Jill and my contact information. We've really enjoyed speaking with you tonight. Stay healthy and safe, and we hope you'll join the Princeton Club for other upcoming virtual events.
Wendy,
thank you, Jill.
So much. Thank you so much for being a wonderful interviewer, and most of all, a wonderful friend. And thank you, everybody, for taking the time to be on the call tonight. And please stay safe.
And thank you, Jill, for your friendship and your insights. And yes, I echo Jill's sentiments. Everyone stay safe and stay well, and pay tribute at 7 o'clock tonight if you're in Manhattan to our pay tribute to the workers on the front lines. Thank you so much.